Now, a hospital is simply a room where you do surgery and some recovery rooms. And they had access to a house right in the middle of downtown, and they opened a hospital. And it had 4 beds in it, plus 6 recovery rooms, and a surgery room and a dental office.
And the McGregor Hospital was built to, quote, sanitary standards. It would have had more plumbing inside, more places to wash your hands than a normal home would have. It had fresh air. Back then, it was very small, but all the rooms would have had large windows that could be opened, maybe more than 1 window per room.
We took care of everything from the ER to surgery to OB in those days. There was one long linoleum hall. So you could stand at one end in the ER, where the ER doors were, and you could see clear down to OB. There was a small little offshoot with some 6-bed wards that patients would be in. There were no private rooms. All of the rooms were double or men's or women's wards.
That hospital obviously didn't have very many modern things. I remember bringing the first chest tube here, the first blood gas machine, things which we all take for granted today, but it still met the needs.
We were a very, very busy little hospital, and the people and the staff responded. I think they did a fantastic job. The greatest people on the earth. I can say nothing but the praise for those good people. And I mean that. They were great. And the county at the time was having a considerable amount of growth by then. The Bloomington subdivision was in effect, and we were not lacking for business at the completion of the hospital.
The board members came into their assignment absolutely determined that they were going to help make this a model healthcare system that would offer healthcare at a very attractive cost to patients, and also have a real focus on quality and try to be a model for the nation and maybe even the world.
Bought us from the county, became a great deal for the county, became a good deal for Intermountain Healthcare, and it became a tremendous deal for us because Intermountain Healthcare had both the expertise and the money to help us expand and stay ahead of the expansion of our community.
The county commissioners deserve a great vote of thanks that could see forward enough ahead and use their positions to get what we got in this valley. Were it not for them, that facility would not be there.
And even embraced it. I mean, they helped recruit specialists into the community because it was the right thing to do for their patients. And that has made a huge difference, and that attitude has continued through to this day.
So what we did at the foundation was we hired a consulting firm who came in and interviewed 50 of the really prominent citizens here in St. George or in the area. And when they delivered their report to us, they said, never in our wildest dreams would we ever raise more than $2.5 million. So we took that proposal or their report to the foundation board, and the board approved it unanimously -1. And that was me. And I was sitting there thinking, you know, Stonecliff, Kayenta, Entrada, we can raise more than $2.5 million. So I said, pardon me, oh hell, we can raise $10 million. And they blew my mind away when everybody said, okay. So that became our goal. And it turned from a $90 million hospital to a $100 million hospital, from a very good hospital to an exceptional one.
Another area that may not get as much attention as the open heart surgery is the neonatal intensive care unit. And having that is big, not just because of the numbers represented, but because of how disruptive that is to families. When we fly an open heart patient out, I mean, that was a big deal, and they were typically in the hospital somewhere for 3 or 4 days, back home in a week. But when you fly a baby up, they may be in the NICU for a month. And typically there are other small children in the household, and so the family is split for a month or more, you know, with a parent trying to be up in Salt Lake and a parent trying to be down here taking care of the other children. So the NICU's made a tremendous difference for our community.
Administration of not only Dixie Regional Medical Center but Intermountain Healthcare System, their desire is to continue to improve, continue to be better all the time, even though they've achieved, you know, great heights in what they provide as far as services and quality. They know and want to continue to do better, and they're committed to do that. They continue to invest not only in time and resources, but in their commitment level in having local people and people system-wide help in determining best practices and best efforts so that they can provide better services and better outcomes.
Is the jewel of this valley is Intermountain Healthcare, and I am very proud to have been
I can have a building, I can have the best technology in the world that can do amazing things, but none of that happens without people. So I have to have absolutely fantastic physicians, and I have to have absolutely fantastic employees that make a difference, and we do.